Now what I like to do is I like to keep the putty matrix on the model, and I'm going to trim the facial aspect. My goal is my putty matrix should be an extension of the wax up, meaning I don't want to have a lip of material coming off the facial. I want the putty matrix to end right at this facial incisal line angle. Make sure you use a nice sharp blade, and I'm going to run my blade right along the facial of my incisor. Now it still has a little lip, so I have to go back and do a little bit more contouring here. And obviously you can have your lab technician or your dental assistant do this for you. Now the challenge is if it's done in wax. If your wax up is actually done in wax, you have to be careful, because if you're trimming with a blade, you could actually be trimming back the wax. That's another advantage of me doing my wax up using composite. It's nice and stable, nice and hard, and I can trim right against it. Now after I've done the initial trimming, I'm going to come back and I'm going to look at this little lip here, and I'm going to trim away this excess right around that lip to make sure that I have my putty matrix will finish at that facial incisal line angle. Alright, so when I'm finished trimming, again I want my putty matrix to be an extension of the wax up. So there's no lip between the wax up and the putty matrix. Okay, dental online trainers, that's how I make a putty matrix for my Class 4 composites. I hope you found this tip useful and helpful for you when you're in your practice. Again, this is a technique that your laboratory technician or your dental assistant can do for you. Again, if you're going to be trimming against your wax up, you have to be careful. If it's done in wax, it will carve away the wax. But it works out really beautifully if you're doing it on a stone model, or a duplicate of the wax up, or on a direct composite wax up.